So if part of your vision ever goes dark or very blurry or something just suddenly pops into your vision, then this could be a sign of a true eye emergency. Some causes could be harmless, but others can lead to permanent blindness or signal a stroke or an impending heart attack. In today's video, I'm going to break down how to tell the difference when you need to go into the ER versus calling your local eye doctor. I recently had somebody very close to me have this exact experience where part of their vision just suddenly disappeared, which can be super concerning. And so I wanted to make this video so that if this ever happens to you or maybe a family member, then you know what to do. Okay, so first, when your vision is changing, we need to categorize this into either vision loss or what we refer to as negative vision changes. This is where things are removed. This is where your vision can suddenly black out. Or perhaps you woke up and you can't see out of one eye, or you experienced your vision slowly fading to gray or to black. Sometimes this is not just your entire vision in one eye or both eyes, but instead it could just be a spot or a quadrant of your vision. Again, that's vision loss or negative vision changes, but then there is positive vision changes. This is where new things are added to your vision. Think of these as like a flash of light or a zigzag or kind of flashing spot in your vision, or just having new moving spots and shapes in your eyesight. Again, they are added to your vision. This simple distinction can help us understand quickly what might be going on and how urgent the situation is. Okay, so let's talk about true vision loss. This is where your vision suddenly goes dark or slowly fades away, or even if it's in just one spot. This is where we are most concerned. In the case of sudden, painless vision loss, even if it's in just one eye, and even if it only lasts a few minutes and then resolves and comes back, most of the time this is an ischemic event, meaning that blood flow isn't getting to the retina in the back of the eye. This is often associated with a thrombotic vascular event and is a huge warning sign of an impending stroke in the brain. And usually this is associated with a stenosis or occlusion of the internal carotid artery or the central retinal artery. Sometimes on occasion when we look inside the eye, we can even see a piece of plaque stuck in the retinal circulation, something that we call a Hollenhorst plaque. However, I will mention that in this sort of case, even if you see an eye doctor, 75% of the time, we won't find anything wrong with the eye. However, symptoms of vision loss, fading to black, or just going dark, these symptoms alone are a red flag for a possible impending stroke or heart attack. Pretty serious. So if you or anybody experiences transient monocular vision loss, something that in the eye clinic we refer to as amaurosis fugax, then I think it's probably not a bad idea to first, as soon as you can, call your eye doctor's clinic, because oftentimes we do triage things over the phone. But do not be surprised if they either refer you or have you call the ER, or perhaps a local hospital that has a stroke unit or stroke center. Usually in this sort of case of this amaurosis fugax situation, they do need to do a cardiac workup as well as something like a carotid ultrasound. And of course, there are other causes of sudden vision loss like giant cell arteritis or inflammation of the optic nerves, hypercoagulable states, arteriosclerotic disease, even vasospasm. Either way, if your vision is fading out or going black, then this may not be just an eye issue. This is likely a systemic issue that needs to be addressed. But in addition to any vision loss, if you happen to have other symptoms of stroke, such as having a challenge speaking or difficulty understanding somebody else's speech, or you have weakness, paralysis, or numbness of the face, arms, or legs, or perhaps you're having difficulty walking and maintaining balance and coordination, or you have a sudden intense headache or altered consciousness, then definitely contact the ER or seek emergency medical care right away. Unless, of course, you live in a very remote area and don't have access to an emergency room, then any other qualified healthcare professional, even seeking your eye doctor if that's the closest person you have. Now, one other cause of sudden vision loss that I do want to spend time reviewing is that of a retinal detachment. The key symptom here is a curtain or shadow of vision loss that usually starts off here to your side. Oftentimes, people experience other symptoms, such as a bright flash of light or new onset of new floaters in their vision, and this usually comes on before you notice any of this shadow or curtain showing up. Sometimes people even see the flashes and the new floaters like a week or two before they start seeing any side vision changes. Now, we've talked a lot about eye floaters here on the channel in the past, and about 95% of the time, eye floaters are a normal part of aging. It's simply the collagen of the gel inside the eye kind of just changing with age, and it slowly peels away from the back of the eye. 95% of the time, it peels away without any real consequence other than you seeing just some new eye floaters. But there's always this small percent chance that it could tear away from the back of the eye, pulling some of the retina along with it, creating this retinal detachment. And once the central retina detaches from the back of the eye, then vision loss can become permanent. But again, if you see any new eye floaters, especially associated with a flash of light or loss of vision, then you want to contact your local eye doctor. Whether they are a doctor of optometry or a doctor of ophthalmology, they're going to be better to see than the ER. The ER docs have to focus on so much more going on, but the eye doctors, we have the equipment and the experience to detect subtle changes that could be going on to determine if it is something like a retinal tear or detachment. But I'll just add here that eye floaters are a normal experience with life, and 95% of the time, new eye floaters won't have a tear or detachment, but people do see those floaters and find them super annoying. That's why we've done several videos about eye floaters and the new technologies that are coming out to remove them. So if you see eye floaters and you're bothered by them and want to learn more, then check out in the show notes, because we'll have links to not only other videos, but even to a podcast where I interviewed some of the top doctors doing these new procedures for removing eye floaters. Again, I'll put that in the show notes, and perhaps I'll even try to tag it in the comments. Now, I just wanted to add here that so far we've talked about painless vision loss, but sometimes you can have vision changes, extremely blurry vision, that comes with pain in the eye, such as angle closure glaucoma, for example. And I think as a general rule, if you're having blurred vision or loss of vision and the eye is painful, probably call your eye doctor first. Again, we just have the tools to better probably assess what's going on in the eye, and if need be, then we will refer to an ER again when needed. Okay, so now let's talk about when something new is in your vision. A classic kind of symptom that people often report or experience is like a zigzag kind of jagged line showing up in their vision. It could be a rainbow color, or they'll see kind of a flashing small strobe light appearance that eventually grows and gets larger in their vision, sometimes lasting just a few minutes, but it can also last as long as an hour. And it may seem like it's only in one eye, but oftentimes if you blink and check back and forth, you'll realize that even though it may be asymmetric, it is still often in both eyes. Now, of course, this can look really scary, but is usually more of a neurological thing and not so much of an eye emergency. And what we've been describing here is something that we refer to as a scintillating scotoma, which is oftentimes seen or described by people who experience migraine or migraine headaches. And if you've ever experienced this visual phenomenon, you may think like, well, I never had a headache or head pain associated with that. It can't be a migraine. Well, actually, it's possible to have a migraine without the headache component. But the symptom of this kind of flashing light zigzag kaleidoscope appearance is still very descriptive of a migraine aura. And I'm just speaking from experience. When I first saw a migraine aura, I was in like third grade, had no idea what was going on or even how to describe it to somebody else. And I think that can sometimes confuse other people too. Either way though, I'm not a neurologist, but usually a migraine migraine and migraine aura doesn't require a visit to the ER unless it's associated with other new neurological symptoms, especially if you've already been assessed by a neurologist. But I will add that I oftentimes find sometimes the best first step is actually just talking to a family doctor or a primary care physician. To learn more about migraine and migraine aura specifically and other kind of associated neurological things that can happen, then check out my other video I did exactly on that topic. Again, I'll put that in the show notes. Okay, so bottom line, if you are experiencing any symptoms of stroke that we reviewed, then immediately call the ER. If you're experiencing any sudden vision loss or vision is fading to black, then perhaps calling the eye doctor first wouldn't be a bad idea, but do not be surprised if they refer you or just have you go straight to the ER or, again, a hospital that has a stroke unit. Now, if you happen to have vision changes, vision loss, that are associated with new eye floaters, flashes of light, or any pain in the eye, then probably best to call your eye doctor first. And if you happen to have something like that scintillating scotoma that we were showing, and you think perhaps it could be related to a migraine or migraine headache, then you could call an eye doctor, but I find that contacting a family doctor or even seeking help from urgent care may be more appropriate. But probably one of the biggest takeaways from this video is that if you are having any changes to your vision, your eyes, something new neurologically is going on, do not sit on it. Best to call your local eye doctor or a local healthcare professional so that we can triage what's going on and get you the care you need. From here, I just want to say I hope this video helps you or a family member of yours out in some way. If you have any experience with something like sudden vision loss and you're willing to share your story, please connect with us in the comment section because I know you're probably not alone. Otherwise, if you did find value in today's video, do us a favor by hitting the little like button down below and again subscribing to the channel if you are new. That does help us out, and that'll be a way for us to kind of get a signal that this is important information, and it'll help the algorithm share it to more and more people. Otherwise, again, Dr. Allen here. Keep an eye on it, and we'll see you in the next video.